Welcome to We Need to Talk, the podcast that features a series of conversations aimed at shedding light on issues surrounding women. I am your host, Leniva Hodge, and this is a space where women can discuss the issues we've been forced to barely whisper. As women, we know we need to talk means things are at a point where they must be addressed now. So join us as we tackle conversations that are necessary, even if they make you slightly uncomfortable. Hi, and welcome back to another episode of We Need to Talk. I am really pleased with the guest that I have in studio today. Yes, I said guest. This is our first episode where we have two experts in their field joining us. And so today's episode promises to be informative. I promise that it's going to leave you very much enlightened. And we are on the topic of sexual and reproductive health. I know a lot of you have been anticipating and waiting for us to reach to this topic, as I promised it at the beginning of the month, that we were going to be looking at health and wellness. I know we've now gone over into the month of May. This is a new month, but there is some overlap between health and wellness and mental health. And so we are going to be covering sexual and reproductive health today. So grab your drink, grab a snack, get comfortable, because we need to talk. And so I turn to my guests today, Dr. Matthews and Nurse Myers. Welcome to We Need to Talk. I will allow you both to introduce yourself to the audience, and then we get right into the topic.
Okay, well, thank you very much for having us on this program. We need to talk, and sometimes that's exactly what we need to do. So, my name is Dr. Karima Matthews, for those of you who don't know. I am a consultant obstetrician and gynecologist. So, I really specialize in anything to do with the female. It can range anywhere from reproductive issues, pregnancy issues, menopausal issues, menstrual issues. So, based on your topic today, we'll focus in and hone in on what you want to talk about. And I work very closely with my nurses in the outlying clinics. I work with Nurse Myers in the South Hill Clinic, but I also work in the South Hill Clinic, Valley Clinic, and also the Welch's Clinic. So, this is Nurse Myers.
And thank you so much, as Dr. Matthews mentioned, for having us this afternoon on your show. My name is Rhonda Myers. I'm a registered nurse, registered midwife, and public health nurse. I also was trained in basically midwifery. So I have that knowledge, as Doctor said, we have that knowledge on reproductive health and sexual health and well-being. I am, as Dr. Matthews also mentioned, I am the health district manager for the South Hill Polyclinic. So I also see antenatal clients, postnatal clients, clients who come in for pap smears, So it is really good to have us here, and we need to talk.
Thank you so much, both of you. I want to start right where you left off, Nurse Myers. Pap smears. What are they? Why do we need to do them? How often do we need to do them?
Very good question. So pap smear basically is a diagnostic test that we do on females. What you're doing, basically, you're trying to get a sample of the cervix, inside the cervix, outside the cervix. We're looking for any abnormal cells, cells that potentially can lead to malignancy or cancer, right? So we're looking for cervical cancer, actually. And as often as we should do it, we recommend once a year. After your third pap smear that came back basically normal, we can skip it until 3. We advise, especially our postnatal mothers, when they come for their 6 weeks postnatal, best time for you to have your pap smear done, and you go onwards from that.
Why is that the best time, postnatal? Is it that the cervix is in a particular position, postnatal 6 weeks, or is it just because you're doing the checkup and you're there anyhow, you might as well do it?
Yes, we do it at the 6 week because we call it like we catching the persons there. You
Okay.
have to come to us for the postnatal visit, so we catch you at that opportunity to get the pap smear done. Because sometimes when we say to them, you know, they don't come back, or if I do a talk or something, persons might not come in on their own voluntarily to have the pap smear done. But if you have to come in for your 6 weeks or 8 weeks postnatal visit, we as the healthcare practitioners take that opportunity because you can't go anywhere. We just catch you at
you're done right there.
Right.
Yes.
So
Captive audience.
right.
Okay.
So we catch you
Definitely.
right there.
Okay.
And we encourage as best as possible to do the pap smear at that point in time. And sometimes when we have a younger female that delivered, maybe a 18, 19, 20-year-old, she may never have done a pap smear before. So she does not know what that is about. So the pap smear, as Nurse Maya said, it is to capture precancerous cells. So it's not a diagnostic test, it is a screening test. So if you have that test and it comes back to say precancerous cells or even cancerous cells, we're not going to just put you on the operating table and do surgery.
Okay.
We go through, we bring you back in, we counsel you to say, this is the type of pap smear that you have, this is the type of result that you have, and the recommendation is you may have to repeat that pap smear in 4 to 6 months, because the pap smear, the abnormal pap smear or the precancerous cells is caused by a virus known as the human papillomavirus or the HPV virus. So, you know, in the COVID lockdown, we had all this talk about virus and you had to stay in and whatever. But remember, our immune system tries to fight any kind of infection that we have, whether it's viral, bacterial, or anything like that. So if I see you today and I say, well, you have an abnormal pap smear showing an early sign of precancerous cells, I'm not going to operate on you. I'm going to advise you and I'm going to tell you it is precancerous, it is not cancer. And it takes maybe 5 to 7 to 10 years to develop into cancer cells without any intervention or any treatment. So when you need to come back to us at 4 to 6 months, and then I would let the nurse know this person needs to come back. So sometimes we have to be calling you because you forget. So sometimes I'm telling the clients, everybody has a smartphone. So if I do the pap smear today, the results come back next month, and I say you need to come back in 6 months, put it in your smartphone so you know when to come back. But we still try to keep a record so we know when to call you to come in. So that's why it's important. We try to capture our audience. Postnatal is one area where we can capture the audience and try to explain. And for the HPV, the human papillomavirus, it is a sexually transmitted infection or virus. It can be passed from woman to man or man to woman. This virus is different from other viruses such as herpes, because herpes you will see bumps or discharge or something. With the HPV, you don't see anything. You might have it there for a long time, and all it does is stain the cervical cells and change those normal cells to abnormal cells. So that is why we recommend, as you said, pap smears every 1 year. And if you're doing the HPV with it, then you can go to every 2 years. And depending on if you have like 3 normal, you can go to every 2 to 3 years. But it is important to note that it is caused by a virus, and by us knowing that, and we also have implemented the HPV vaccine.
I was waiting because I wanted to get there. So I was going to let you finish, and then we're going to go to those vaccines, because I want to definitely know more about the HPV vaccine in terms of who can get it, what is available, if the latest vaccine is even available here in Anguilla. Because I know that there are different types in terms of who can get. So yes, definitely. Let's speak about the HPV vaccine.
Right. So You want to go ahead,
Okay.
start first? You can
Yes.
start first.
And I know just for our audience, and sometimes I know a lot of the audience is based here in Anguilla, but we do have persons outside of Anguilla that watch the show as well. But at the time of recording this, this will be, by the time you see this, it would have been last week. But we are
Okay.
we are celebrating Vaccine Week here in Anguilla this week
Yes.
that we're recording. So just a bit timely that we're speaking about this as well.
Definitely. And I'm so happy to have the opportunity to speak about the HPV virus and also the HPV vaccine. Now, the HPV vaccine that we have here locally is the Gardasil. It's a 1 dose. So prior, you would have had like 2 dose. Some persons would have had 2 dose. But now, what is available is the 1 dose vaccine. And it is recommended for both boys and girls, male and female. As Dr. Matthew said, the HPV virus can be transmitted from male to female and female to male. So our target age is between 9 to 15. Why we recommend that age is because that is the age we would want to say prior to these young children.
Sexual activity.
Yes, they begin sexual activity. So if we can immunize them prior to being exposed to the virus, that is where we will be able to lessen the incident of whether cervical cancer. Because the thing is, the HPV virus not only can cause or lead to cervical cancer, it can also lead to anal cancer, penile cancer, throat cancer. So we have to look at the young men. We don't really want to leave them out because we don't want them to be affected by this HPV virus that can cause these cancer also.
You know, it's interesting because I remember a few years ago when the HPV vaccine was first introduced to Anguilla, there was a subsection of persons who didn't necessarily like the idea of it because it is a vaccine for an STI. And so they were like, well, if you give this to the children, it is encouraging sexual activity. But I do like that you mentioned that it's given at a point before they start sexual activity. And let's face it, it's a human, like it's just a human act. Most people, the majority of people, at some point in their life will engage in sexual activity.
Definitely.
And so if we can prevent it, what I didn't realize before was that HPV can also lead to penile cancer and anal cancers and those different types of cancers. And at the time, a lot of the pushback was coming from the male population. And I remember thinking, because I know it was, okay, but we know HPV can lead to cervical cancer. And I'm thinking, well, if these men knew that it could lead to penile cancer, they would be the first in line.
Definitely. Definitely, because they don't want that there.
They would be the first in line. So how open and how receptive have we seen persons become to the HPV vaccine here? And I know you say it's recommended from 9 to 15, but is that the cutoff age? Can you get it later on if you've not been sexually active, or even if you have been? What is the parameters if you...
You can get it later on. However, for prophylactic purposes, because you want to give it before the person is sexually active to reduce their burden of getting the amount of virus that would lead to them getting abnormal cells. And even though it can affect men and throat cancer and anal and all of that, the majority of the burden lies with the female population, and that's why we push for pap smears and do your pap smears every year and check up and check up and check up. So yes, we want to educate that boys and men can get it as well. And remember, if you have, not gonna say anything, you know, but we know our Caribbean men, but if you have one man and he have 10 girlfriends,
same story,
right? So he can pass it on to those, even though the woman might say, oh, I'm being faithful, I'm not doing anything, and then she turns up with an abnormal pap smear. So sometimes when I see them in the office and they break down crying, and you know, they may have read up on it to say this and that, then they want to, you know, who should I blame? But this virus can be in your body for years. So it might not be the immediate
Your
partner
partner.
that you're with. It could be a previous partner. So sometimes I cannot say it is this specific partner that passed this on to you. And with the vaccines, I know we have the Gardasil and the Cervarix. When I just came here, the recommended dosage was 3 doses, 1 month, 0 months, 1 month and 6 months, or 3 months and 6 months for the viruses. So now you're saying that it's only one dose.
Mm-hmm.
And for each vaccine, they would have targeted, because for the HPV virus, you have over 100 types of virus. So it's virus 13, 16, 6, 8, 11, 51, 33, etc. And there are some types that we call low risk. So those types cause what we call genital warts.
Okay.
So genital warts is not cancer. It's not going to kill you. It's not detrimental to you. If it is a lot, then we may have to do a surgical procedure to remove them.
Okay.
And then you have what we call the high risk types, and that's the type that's going to cause cancer. So normally, the newer pap smears these days will check for the high risk types of the, and then the vaccines also target those types as well. So that is what is important for us to educate persons and the population about high risk types. That's going to cause cancer. The low risk types will cause what we call condyloma or genital warts, which is not necessarily detrimental to you as a cancer would be.
But it may not be pleasant.
No, it's not
It's
pleasant.
not. It's not.
It's not
That label,
pleasant.
it's not.
Okay.
Definitely. You don't want to be told that.
Right.
And then you will, and some young women would come in and say, they notice a growth there. It's not painful. It's not getting any bigger. But when they wash in the shower, they notice that they feel something there. When I examine, I could say, okay, I can remove this, and then we test and treat and so on and so forth. But yeah, it can be there. Okay. So we recommend that. And January is cervical cancer month, and we try, it's not as big as breast cancer awareness, where we do the walk and wear your pink and all of that. But January is cervical cancer month, and we try to, in aid with the Cancer Society, we try to do projects in terms of where I would do free pap smears for persons who are eligible. So when you come in, you don't have to pay. You get the health fair voucher and so on. Yeah.
So I noticed both you and Nurse Myers, you say cervical. Is that a pronunciation difference between cervical cancer? Because some people say cervical. Is that a...
I guess maybe it's just a preference. Or it's a cervical or cervical. So it's just a preference.
Okay.
None is wrong.
Okay. I just
and
wanted to...
once you know what we're talking about, yeah, that's fine.
I just wanted to address that, whether or not it was just a difference in pronunciation.
Yeah.
Okay. So
potato.
There you go.
Right.
Okay, just you did ask before what is like the buy-in.
Yes.
So we did these primary schools this week, and we noticed that we have a lot of parents giving consent for their boys, their sons, to have. And I was like, okay, this is good. You know we have a lot of work to do concerning your child being vaccinated against the HPV, because sometimes, misinformation can really and truly hinder what we really want to achieve. But the buy-in, I find, was really good when it comes to the males. So we're hoping that with more education and all of that, persons will, we will see a little more person accepting the HPV vaccines.
Because a lot of times, as you mentioned before, the church or some other persons, the parents are saying, oh, by providing this vaccine in schools, we're promoting promiscuity. Yes. And that's not what we're doing at all. We're just trying to make persons be safe, and we give it before we think you're engaging in any kind of sexual activity, and then give you the information that you need. And before, there was such resistance with the boys. You know, some of the mothers would come and, you know, say the girls would get it, but there was a lot of resistance with the boys. So I'm happy that you're
Yes.
saying that there is more uptake with
Yes.
the boys now,
Because this is the year we start with boys.
yeah, it's going to make a difference, because since the advent of the cervical cancer vaccine or the HPV vaccine, there has been a reduction in cervical cancer by over 50%.
Oh, wow.
Yes.
Ooh.
So with the vaccine, and also with spreading the word for doing a pap smear, it's a screening test. I mean, it's not pleasant. Nobody wants to see the speculum. Nobody.
We were
nobody
going
wants
to
to
talk
see the
about that speculum.
speculum.
There is no way that we were not going to talk about that speculum today.
but we're not there for 3 hours. You know, it's not major surgery.
Yes.
So it's over, I would say, in a quick time, you know.
Yes.
I still have to get mine done, and I'm like, oh Lord. Nobody goes in like, oh my gosh, I'm so happy to get my pap smear today. But it's something that we have to do, you know. It's once a year, maybe twice or 3 times a year that you have to do it. So just make up your mind and do it, you know. Yeah. And I would tell patients, once you relax,
Yes.
and just
Yes.
go in the proper the frog leg position.
Definitely.
Yes, the speculum is inserted without any problems, and it is done.
But you know, you get in there.
I know, and your
And
mind
your
takes
mind
over.
Your mind is already, oh my goodness, I have to do this. I have to spread eagle, you know, for doctor to come in here and see all of my business.
Yes.
So it's
not the most
know,
pleasant.
It's not the most pleasant. And you know that, yes, I should relax, but my mind is telling me,
Yes.
how am I to relax
In
this
that
very
position, yes.
uncomfortable position?
Yes.
But yes, relaxing and, you know, you scoot down a little bit more.
Yeah,
baby.
yes.
Yes, we do.
You know, you
Do that.
a little bit more. You scoot to the edge, and anybody who's have one, you know, these are the things that. And I go, but how much further off this? How much further can
but
I
a lot of the times you're like halfway up the bed. You're not even all the way down.
And in
but
my
in your mind,
yes,
you're thinking that, oh my goodness.
I'm already there a little bit more.
What I find, some of the younger persons now, like the 18, 19s, 20s, like when I explain to them, you know, and they're like, oh gosh, but my sister tell me it's a hot man, it's a hot doctor. And I say, no, just follow me and listen to what I'm telling you. They go on the bed, and I say, just relax. And I say, you know what? Because we have different size speculums. So that's why I like when we have the different sizes.
Okay.
So you have what we call even a virgin speculum, in case we need to do some kind of examination for somebody who is not regularly sexually active. And that's maybe just this big. It's very teeny tiny. And then we have the small, medium, large, extra large. So depending, so if a young person comes to me and says, Doc, maybe I've had sexual intercourse, you know, just a couple times, I'll start off with the small one. I'll go with the small one. If I know you delivered 7 or 8 children already, I could go with a bigger one because, you know, I know these things. But normally when I would tell like even the younger persons, and I just say, just listen to me, I do it, and they're like, you finished already? I say yes, because a lot of the times they think we're doing a biopsy. They think we're cutting something off of the cervix. We're clipping something with scissors or something. And I said, no, it's a little brush or it's looking like a spatula. Like a little ice cream thing, the wooden thing that is there. So it doesn't really hurt. The most thing to me that would hurt is the speculum going in and then opening it out for me to see the cervix. After
that pressure.
That pressure, right. But for most of the times, once you follow my voice and listen to me, it's not pleasant, but it's not like I'm not killing you. Just to make that clear.
And let me just interject here.
Yes.
So yes, doctor does pap smear, but we as midwives also do
the
pap smear.
smears, yes.
So I know doctor has a lot of clients because she has her antenatal, she has her postnatal, she has other person with basically any gynecological problems, right? So we have nurses now at all 3 clinics, health centers. So they are trained to do pap smears, our midwives. So it doesn't mean that you have to make appointment to see doctor.
Ah,
Pap smear is done at South Hill on a Tuesday morning. It is
Mm-hmm.
also done at Welch's on a Tuesday morning and Central on a Friday. So you have
all day Friday, Friday
Friday
morning,
mornings.
Friday
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 mornings.
mornings.
mornings,
Okay.
yes.
So if you call and said, "Hey, my last pap smear was 2 years ago. I don't have any problems at all. I don't have no sickness. All I'm doing is just coming for a pap smear." Then they'll just book you for the nurse's clinic to do it. If there's a problem, if the nurses tell me, "Doc, I saw something on the cervix that I didn't like. She has a polyp or she has a growth or something," then they will transfer that patient to my clinic. But you can go to the nurse's clinic to get your pap smear done once you don't have any other complaints or issues. Yes.
Good. So we've made it easy. We've put things in place, remove certain barriers so that persons can get their checks because it is important.
Very.
I want to go back just a little bit to the HPV vaccines and just give you Nurse Myers an opportunity. So for anybody that is listening, parents who may have teenagers, yes, by the time this airs, vaccine week would have passed. So just bear that in mind. But if a parent wants to have their child, they may have been past the primary school age, but they now want to have their child vaccinated against HPV. What do they need to do and how can they get it?
Okay, so it's very simple. You can just visit any one of the health centers. The 3 health centers are staffed with public health nurses, like myself. We have nurse Faye Thomas Astafan at Welch's, and we have nurse Minda Smith Lake at Central. You just visit them. We make the arrangement. Once you give your consent, we sit you down, we explain any questions you have. Because sometimes, although you might say, yes, I realize this is best for my child, but I still have maybe 1 or 2 questions. We'll explain anything, give you the opportunity to voice your concerns, and then we proceed. So it's very easy. You just call and you make arrangement, time when they can sit with you, chat, and it is administered.
Excellent. So for anybody out there who is listening and you either through this medium you've now said, okay, I want to get my child vaccinated, repeat those dates again for the days that they're available at the clinics again, that they can go in.
For vaccination, okay, so vaccination now, that is different from the pap smears.
Okay, so that's different.
Yeah.
Okay.
But vaccination, once you call the clinic, you let them know what you need or what you would like, and then the nurse will make arrangement for you to come in time and whatever.
Especially for the minor.
For the minor.
Yes.
Excellent. Excellent. So please take that opportunity for anyone listening who may want to have their children vaccinated against HPV. You may not have gotten a consent letter. Your child may have exceeded or passed that stage and you want to do it. Give the health centers a call and you can arrange to get that. So thank you for that, Nurse Myers. I think that is really important that we get that information out there because I think I'm still a little bit taken in what Dr. Matthews said, in that since the advent of the HPV vaccine, we've seen the reduction of cervical cancer by 50%.
Yes.
And so it is so important.
And regular pap smears.
And regular pap smears and the HPV vaccine combined together. So we have those at the clinics. Both the vaccine and the pap smears, you can do that. Take whatever steps and necessary to avoid your risk, or to know your status early.
Yeah.
Dr. Matthews, in terms of the pap smear, before we move on, because there's so much to cover, and I
yes,
there's a lot to cover.
Definitely.
It could just be a topic on pap smears.
All day, yes. But I don't want to miss this. When should persons get their first pap smear?
Okay, so for pap smears, we recommend 3 years after your first sexual encounter. And we know now that in my time, and the time being now 2024, teenagers are more, forward, if I would want to use another word. So in my clinic, have seen persons come in. The mothers have carried in their daughters at 14 or 15 and said, Doc, I think she's sexually active. Check her out or do this or do that. So if the daughter has said, you know, I started engaging in sexual activity at 14 years old, she should be doing her first pap smear at 17 years old.
Okay.
All right. And depending on how many sexual partners, etc. Generally speaking, they would say your first pap smear will be 21 years old. But it depends. If you started having sex earlier, then it would be earlier.
Okay.
There was another discussion about if somebody is a virgin or not sexually active, if they need to do pap smears as well. But sometimes, even if you're not sexually active in terms of penile penetration, you might be doing other things.
Let's speak about those other things. Are we speaking digital play? Are we
It could be
speaking oral
digital,
play?
it could be oral, it could be toys, it could be other
okay.
things. So, and you know, experimentation and this and that. So persons are saying, so sometimes when somebody comes in, I have to be more specific in the questions I ask. Because if I said, are you sexually active? They'll say no. And then I would say, okay, but do you have a boyfriend? Yes. What do you do? They would do rubbing, penetration, finger, and, you know, a toy. So that's an avenue that could cause kinds of issues as well. So if you're doing those kinds of things regularly, because for the teenagers, sometimes they would say if there is not actual penile penetration then in the vagina, then it's not sex. So whatever else they do,
everything else, nothing
not
counts.
right.
Count.
Not right.
Okay.
So sometimes I realize that I have to be more specific in the types of questions that I ask. And I've had mothers that have carried in their daughters at 13 years old, at 14 years old, and say, Doc, do a pap smear. And I'm like, I don't want to do a pap smear on a 14-year-old. And you know, sometimes I'd ask the mother to step out because the child would be shy. But when the mother steps out, she would say, oh yes, I have 2 boyfriends, or you know, this or that or whatever. And then I was like, okay, she needs a pap smear then because she's been, you know, going on. But each case is different, so you have to try to get all the information that you can before you decide. So generally speaking, pap smears by the age of 21 years old, 3 years after sexual activity. And if you come to the hospital and you deliver a baby at 17 years old or 16 years old, which has happened, then when you come to the 6 or 8 week clinic, we do a pap smear there.
Captive audience.
Yes.
Yeah.
Great. So we've covered pap smears. We've covered HPV. We've covered the speculum, the trinket speculum.
The monster.
The monster. And we've also kind of waded into the waters about Caribbean culture.
Yes.
There is no denying that our culture leads to certain environmental factors, which increases our chances of other STDs and STIs. First off, let's start. What are STDs? What are STIs? Break down the difference between STDs, STIs. Is there a difference?
Yes, there is. So the STIs basically stand for sexually transmitted infection. STDs is sexually transmitted diseases. So the difference really and truly, most infections can be treatable, right? So things like chlamydia, gonorrhea, those things, you can be treated with antibiotics. So STDs like HIV, you know, there's no cure. You can treat, but there's no cure for those.
Okay. So infections, get yourself checked out. Treat it. You good to go.
Yes.
I don't want to say good to go, but you know, the infection leaves your body.
And sometimes the infection can lead to other things, but early treatment is the best.
Which is why it's important to get checked out.
Definitely.
Because remember, gonorrhea and chlamydia, if you have that and it's untreated, it can lead to you having infertility or subfertility, because that can lead to blockage of your tubes. So sometimes if you indulge in sexual activity in your teens, 18, 17, you have a little discharge, you didn't get it checked out. And then now when you want to start a family at 27, 26, you realize you're not getting pregnant.
Nothing happening.
We send you to do a test to check on your tubes, and we realize that one tube is blocked or both tubes are blocked. And that's usually as a result of chlamydia and gonorrhea are notorious for that.
Okay.
So even though it can be treated, you should treat it early.
Oh,
But
yes.
sometimes you might see some kind of signs and symptoms, but you kind of brush it off because you don't want to go to the doctor and blah, blah, blah. And then when you wait until such a long time, it wreaks havoc on your tube.
Okay. So, chlamydia, gonorrhea. What are the symptoms other than the discharge? What are the symptoms? And if it's not treated, does it go away on its own, or does it just? How does that work?
So sometimes it can go away on its own in terms of, just like if you have the flu or any kind of bacterial infection or viral infection, your body's immune system is always, once any foreign body is inside, it will always try to get rid of it. However, you don't know what's happening on the inside. So you might feel better, but then there are things going on the inside.
Okay.
So once you see because some people would say, oh, I did have a discharge at that time, it was smelly, it was yellowish, it wasn't my norm, there was itching, there was this, there was that, but then after a week it kind of went away by itself, it was less yellow, it was this or that, and then eventually it went away, but then it was wreaking havoc on the tubes on the inside.
Okay.
So when we do the test, we realize your tubes are blocked and your cilia is clubbed, your tubes are clubbed. When we do like laparoscopy surgery to check on the inside of the tubes, we see that they're not open. So the egg will never get an opportunity to meet with the sperm for you to become pregnant. So that sets up a situation for infertility or subfertility. So now, because we have the advent of a lot of IVF procedures and so on, we don't like to say infertility anymore. So it's not that you can't get pregnant, it's that it's going to take a little more work and a little more work on the part of the doctors as well to try to get you pregnant.
So not being able to get pregnant without intervention.
Correct.
Okay. So those are STIs, chlamydia, gonorrhea, and STDs, HIV, AIDS, anything else falls under that realm, because sometimes we go, okay, well, HIV and AIDS, that's at the extreme, but is there anything else in between there that falls under STD?
Well, you have any kind of infection that is sexually transmitted. So whenever a young lady comes and she says to us she's pregnant, we do the antenatal panel. So in the antenatal panel, we check for HIV, we check for hepatitis, we check for syphilis or the VDRL. And if you come saying that, you were diagnosed with herpes before, we will check for that as well, because you don't want to have a herpetic infection at the time when the baby is going to be delivered. So if you have an outbreak at that point in time, we would not recommend the baby to pass through the vaginal canal for a vaginal birth. So if everything is good, you could have a vaginal birth. If there's an active infection at the time, then we would recommend a cesarean section so the baby wouldn't have to risk passing through. If you are diagnosed with VDRL positive or syphilis positive, syphilis can be transmitted mostly transplacentally. So even before the baby is delivered, the baby can acquire that infection from you. So if a person is positive for that, they would have to do the confirmatory test. So if you come to me today and you have a HIV positive, I'm not going to say, okay, let me give you a prescription for all these medications. You have to repeat the test, do a confirmatory test, and then we see what's going on. Then there's partner counseling, and so it's the same thing with your VDRL and all those other things. Once that is confirmed, then we have to tell you about the complications that can occur with the baby, because there are numerous complications with the baby. So it's not just, okay, you can have neurosyphilis and all sorts of other things. So that has to be communicated to you, the parents, to know what you can expect depending on the level. So if, depending on the level of infection that you have, so is the infection level like here, or is it like way up here? So we're expecting a lot of complications that can happen. So with our pregnant mothers, again, that is what we call opportunistic screening. So
Okay.
when they come in, when they're pregnant, HIV, all of those things are done for them.
Outside of pregnancy, how often should one be screened for STIs, STDs? How do you go about doing that?
Well, I would recommend every 3 months.
Every 3 months.
Why I would say that? Because we know for HIV, there's this window period. So if I had my last sexual encounter was today, and I do a HIV test today, I can only know if I am infected 3 months prior. So if you know you have did your last 3 months and you're good, there's nothing showing up, you still need to do routine checks. And I would recommend also if you change partners.
Okay.
Very, very important. One of the things that we try to do when we have persons joining family planning, when you come for a contraceptive method, we send you for screening tests also. So that is one of the areas where we capture persons to check to see if they have the same VDRL doctor mentioned, which is syphilis. And sometimes, we recommend other tests too, not just the standardized VDRL, other, because once you're sexually active, you're coming for family planning, you're coming for some sort of contraceptive, it's because you don't want pregnancy. And you don't want pregnancy because you're having sex. So until you're having sex, it is good to do these routine checks. 6 months isn't bad because, sometimes everybody don't want to do it that often. But roughly, I would say between 3 to 6 months.
What happens if you are with, and again, we're going to say this in the Caribbean context. If you are with one partner, does the same 6 months apply? Again, taken into consideration.
Well, I could tell you, because the thing is that, as Doctor mentioned earlier, a woman tends to say, okay, I'm not cheating and basically faithful and whatever, but we don't know what our partner is doing. So even if you have one partner, you don't know what your other partner, how much your other partner has, it is recommended that you be tested. I know there was cases where husband and wives, and the wife has HIV and is like, I'm not going anywhere, but it's the husband. And it could be vice versa. We don't want to just say husband like it's only the husband cheats, because that is not so, right? So even if you have one partner, it is good to do, like when you're doing your yearly checks, you do your screening, definitely. Yes.
And it's always a difficult conversation. So if a woman comes to me and says, Doc, I noticed this bump, or sometimes they don't look to see what it is, but they say they feel a burning down there and it's itching or something. So when they come and I check, I said, okay, this looks like a herpetic lesion. And she says, herpes? Where would I get that from? So we have to go through that discussion. And then if I do the test to confirm that it is herpes, and then I said, sometimes they said, but where would I get it from? I said, well, herpes is a sexually transmitted infection. She only has one partner. I said, well,
we don't need to test. We
We
don't need to test your partner.
Right, but then sometimes she would say, but I don't know how to tell him that I have herpes. Because then...
But Doc, that's a different question, because I ain't telling. But I ain't telling, because if I know
that you not doing
I ain't out here doing anything.
So
mister, we going together.
But a lot of the times now, I would have to set up a meeting with myself and both of them, because she doesn't know how to explain properly and she doesn't know like the questions to ask. And then I don't know if he's not forthcoming or something like that. But a lot of the times when one partner tests positive, to convince the other partner to go for testing, then I have to be like a medium in between to explain why it is necessary, etc., etc. And sometimes when we check on the antibodies can give me an idea if this was a new infection that you just got, or this is something that you got from sometime before, to kind of gauge the situation, to see what's going on.
So I see how that could be a little bit for lack of a better
Tricky.
term, sticky.
Yeah.
Definitely.
Because yes, and we are going to get into it. I'm looking at the time, and I know we're going to have to do a part 2 of this episode because these are, and no pun intended, but these are some of the burning questions.
It's burning.
Yes,
You know,
definitely.
the burning questions that persons have. So we're going to come back and do a rapid fire kind of bit in terms of question answer before, but we're going to wrap up this one first, and then we'll come back and we'll do that one. It is so important, and I think these conversations are important for us to have, and to have with other women, to have with other people, because we have to know the effects that having sex with multiple people isn't just fun, but it can have detrimental effects,
Definitely.
both physical and
Mental.
mental effects on your partners, because they're sitting there thinking, well, I am a married woman, or I am in a long-term committed relationship. I am fine. I go in for my annual checkup because I have to do my pap smear anyhow. So I'm going to go in and do my annual checkup. And I'm thinking, the worst doctor could come back with is, okay, we see some precancerous cells. That's the worst you're expecting. But you're going to do that because, hey, I'm here, let's do this one time. The mental toll that would take on a person to get that information. And yes, we're speaking because this is a show geared towards women, but I do know that men watch as well. And so vice versa. For a man to go in for his annual checkup and he goes and he does his screenings and thinking, well, you know, I expect all to be well, but to find this out, it takes a major toll. And yes, when this airs, we will be in May. We will be celebrating Mental Health Month. And so, again, these conversations are not happening in isolation. It is important that we recognize the effects that this type of behavior can have, not just on the physical being, but on the mental part of our body as well. So, we're wrapping up. We're gonna speak a little bit more. Let's check our timing. We're gonna come back and do some rapid fire questions. Make that a part 2. So, Nurse Myers, I hope you can stick around with us for a little bit. We can do that part 2. I really enjoyed speaking with you. I know Dr. Matthews is gonna stay with us. So, thank you so much for being here. We'll be right back for part 2. Thank you for joining us here on this very riveting episode of We Need to Talk. It's been a lovely conversation. We've just literally scratched the surface of the conversation. So we're going to be back next week, and we're going to do a rapid fire question style interview with Dr. Matthews and Nurse Myers. Be sure to like, follow, and subscribe to all of our social media pages. Let's keep the conversation going, and we want to hear from you. So there's a link attached to this poster on our Facebook page, and it is in our bio on Instagram, where you can send us your anonymous questions, and Dr. Matthews and Nurse Myers will tackle them when we return next week. Because as always, we need to talk.